Do you have insulin resistance? If you or a loved one lives with mental illness, it may be important for you to know if you have insulin resistance or metabolic dysfunction, and if you do, how you and your clinician can treat it. Welcome back to Metabolic Mind, where we're working to revolutionize the treatment of mental illness by providing information and resources at the intersection of metabolic health and mental health. I'm Dr. Bret Scher. Metabolic Mind is a nonprofit started by Roblox founder David Baszucki and his wife Jan after their son Matt sent his psychiatric symptoms into remission with a metabolic intervention called nutritional ketosis. Our goal is to help families like theirs learn about this new approach to treating mental disorders and to offer a message of hope that freedom from the burden of mental illness is possible. In previous videos, we showed you how insulin resistance and metabolic dysfunction are associated with an increased likelihood of mental illness and vice versa. And we showed how treating insulin resistance, at least mechanistically, may improve mental illness symptoms. In this video, we'll show you how to easily test for insulin resistance so you know if you're at risk. And we'll wrap it up with a simple, reliable test that you can do at home with no need for healthcare providers. Now, insulin resistance, also known as metabolic dysfunction, is a precursor to metabolic syndrome, prediabetes, and type 2 diabetes. It's a major source of increased risk for cardiovascular disease, as well as potentially for dementia or even cancer. That's why it's crucial to know if you have insulin resistance and to take measures to improve it, given the serious health risks. But insulin resistance and metabolic dysfunction are also associated with symptoms of mental illness. Therefore, treating it could potentially give this rare 1-2 bonus of improving systemic health and mental health. Insulin resistance is what it sounds like. Your body is resistant to the effects of insulin, specifically how insulin signals cells to access glucose and produce energy. Now, traditionally, metabolic dysfunction or insulin resistance isn't diagnosed until someone has what's called metabolic syndrome, which shows up as increased triglycerides, increased fasting glucose, waist circumference, and blood pressure, and decreased high-density lipoprotein or HDL. Now, if you have the characteristics of metabolic syndrome, that's crucial to know, and it means you're at risk for a host of other medical complications. But by the time you get diagnosed with metabolic syndrome, insulin resistance could have been going on for years or even a decade or more. So it's important to screen for insulin resistance and catch it earlier. And as we mentioned in prior videos, that means not relying on tests that are most common, like fasting glucose or hemoglobin A1C alone. And that's why the first test I recommend is a HOMA-IR, or Homeostatic Model Assessment for Insulin Resistance. It's a fancy name, but all it is a formula using fasting glucose and fasting insulin. It's an easy blood test to do, and the lab calculates the results. If the result is less than 1, that's great. That suggests you don't have insulin resistance, or likely don't. If it's greater than 1.9, well, then it is likely that you have insulin resistance, and greater than 2.9 is consistent with severe insulin resistance. Here's an example of how this works. Let's say you have a fasting glucose of 95 milligrams per deciliter and a fasting insulin level of 3. So then your HOMA-IR is 0.7, which is excellent and shows great insulin sensitivity. But what if you have that same glucose level of 95 milligrams per deciliter, but now your insulin level is 27? Now your HOMA-IR is 6.3, which suggests severe insulin resistance. If all you checked was the fasting glucose of 95 milligrams per deciliter, you would have no idea about the underlying metabolic pathology. That's why it's so important to also check your fasting insulin and compare it to your glucose level with a HOMA-IR. Another test commonly used for insulin resistance is an oral glucose tolerance test, which is where you drink this not so tasty 75-gram glucose solution and check your blood glucose levels every 30 minutes for up to 2 hours or more. It's a common test for pregnant women, but not a very popular test given the time involved and the taste of the stuff. Remember, as I mentioned before, glucose alone only tells part of the story. So even better than a glucose tolerance test is a Kraft Test, which is an oral glucose tolerance test that combines insulin levels with the glucose levels. This can be a very helpful test, but unfortunately it's not easy to get a doctor to order it, and it's logistically difficult to do as it takes many hours and many blood tests. So I don't recommend it as a general screen for everybody, but if you start with a HOMA-IR and that's not diagnostic, then it may be worth pursuing and asking your doctor if a Kraft test is right for you. Now, in just a second, I'm also going to let you know about the simple test you can do at home without the need for a blood draw or for doctor's orders. But first, remember, our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice, nor are we establishing a provider-patient relationship. Many of the interventions we discuss can have dramatic or potentially dangerous effects if done without proper supervision. So consult your healthcare provider before changing your lifestyle or medications. So what's the easiest test to do at home with no labs required to see if you might have insulin resistance? It's your waist to height ratio. Studies show this to be a very reliable test, and with results less than 0.5, you're unlikely to have insulin resistance. But if your waist to height ratio is greater than 0.5, it's much more likely that you could have insulin resistance. Now, the test isn't 100%, but what test is? For a non-invasive test that doesn't require a doctor or a lab test, it's pretty much as good as it gets. But you want to make sure you do it right. So here are a few quick and easy tips. So stand in front of a mirror with your feet shoulder width apart. Find your uppermost hip bone and use the mirror to place the tape measure horizontally across your stomach to your other uppermost hip bone. Now, if you can't find your uppermost hip bone, don't worry, that certainly happens. You can estimate it by going 2 fingers below your belly button. Next, take 3 easy breaths in and out, and take your official measurement at the end of the 3rd shallow breath. Now, notice I said shallow breath, no sucking in your stomach or big strong exhales. Those will invalidate the measurement. And that's it. It's as simple as that. You divide your height, either in inches or centimeters, by your waist circumference, also in inches or centimeters. If it's greater than 0.5, it's suggestive that you could have insulin resistance. And you can combine those results with blood tests such as a HOMA-IR or your fasting glucose, triglycerides, HDL, and your blood pressure for an even more certain diagnosis. So now you know how to tell if you could have insulin resistance and why that's important. As we've mentioned, it could have a profound impact on your overall health and your mental health. Now you're probably wondering, if you have insulin resistance, what can you do about it? Well, in the next video, we're going to explore how nutrition can impact insulin resistance, metabolic health, and symptoms of mental illness. That's right, something as simple as what you eat can have significant benefits or harms, both systemically and mentally. So please watch that next video for more information. And if you found this helpful, please click the thumbs up and subscribe button and share this video with your friends, your family, and your healthcare providers. You can help us change the face of psychiatry by sharing this information. And please leave a comment, as we'd love to hear from you about what you found helpful. All right, we'll see you in the next video. Thanks for watching. Have a great and healthy day.